Welcome to the Explainer. Today we're diving into hypertension, or as you probably know it, high blood pressure. But listen, this isn't about throwing scary statistics at you. We're going to show you that a high reading is not some final verdict. It's actually the starting point for a clear plan to take back control. So let's set the scene. You're at a routine checkup, right? The cuff gets tight, and then the doctor tells you your blood pressure is high. It's a moment so many people have. But what does that number really mean for your health? And what in the world happens next? Okay, let's get into it. First things first, let's talk about the silent number problem. You've probably heard hypertension called the silent killer. And that's because, well, you usually can't feel it. There are no obvious symptoms. So the very first step is just knowing the number. The exact threshold where blood pressure goes from being normal to being classified as high. Now, the key word here, and I mean the most important word, is persistent. A single high reading at the doctor's office does not automatically mean you have hypertension. It has to be a consistent thing. And you'll notice the number for home readings is actually a little lower. That's because of something called the white coat effect. You know, that thing where your blood pressure shoots up just because you're a little nervous sitting in a doctor's office. It's super common. Okay, so once it's confirmed, doctors don't just say it's high. They classify it into grades. The top number, the systolic, that's the pressure when your heart is actively beating. The bottom number, diastolic, is the pressure between beats. So, for example, if you get a reading of, say, 150/95, that would put you in grade 1, or mild hypertension. These grades are really important because they help figure out how urgently you need to act. So how do we get to that confirmed diagnosis? Well, doctors don't just take one number and run with it. It's not a snap judgment at all. It's actually a really careful process designed to get the most accurate picture of what's really going on. And it's very methodical. Step 1, repeat, repeat, repeat. They need to confirm it with multiple readings on separate days to make sure it wasn't just a fluke. Step 2, they'll want you to check it at home. This gives a much more realistic view of your day-to-day pressure away from all that clinic stress. And step 3, this is absolutely crucial. They don't just treat the number on the cuff. They look at the whole picture and calculate your overall risk for cardiovascular disease to build a plan that's truly for you. Another thing doctors need to figure out is which type of hypertension we're dealing with. For the vast majority of people, I'm talking 90 to 95% of cases, it's what we call essential hypertension. This means it just develops gradually over time, usually after age 40, without one single clear cause. The other, much smaller slice is secondary hypertension, and that's when it's triggered by something else, like a kidney issue or a thyroid problem, and it tends to come on much more suddenly. All right, now we get to the really empowering part. Because no matter the type, no matter the grade, the game plan for everyone starts in exactly the same place, with real, practical lifestyle changes. This is your first and honestly, your most powerful line of defense. And these are the big ones, the changes that are proven to work. And they work for very logical reasons. When you cut back on salt, your body can let go of extra water, which lowers the amount of blood your heart has to pump. Makes sense, right? Regular exercise makes your heart stronger, so it can do its job with less effort. And diets like the DASH or Mediterranean are packed with nutrients that literally help your blood vessels relax. These changes are a huge deal. But you know, sometimes lifestyle changes on their own just aren't enough to get that number down to a safe level. So when does medication enter the picture? Well, it's not a random decision. It's all part of a very clear medical action plan. Hey, remember that cardiovascular risk score we talked about? This is where it becomes a game changer. If your blood pressure is in that mild, grade 1 range, but your calculated risk of having a heart attack or stroke in the next 5 years is 15% or higher, that's the trigger. That's when your doctor will likely recommend starting medication. See, it's a strategy that treats your total risk, not just the blood pressure reading by itself. Now, the other trigger is much more straightforward. If your blood pressure is consistently hitting 160/100 or higher, that's grade 2 and up, then medication is recommended right off the bat, no matter what your risk score is. At that point, the pressure itself is just too high, and the immediate priority is to get it down. And the medication plan itself? It's not guesswork. It's a very logical, stepwise process. A doctor will usually start with one first-line drug. If that doesn't get you to your target BP, they'll add a second drug from a different category. Still not there, they might add a third. It's a systematic approach to find the perfect combination that works best for you with the fewest side effects. So getting your blood pressure down is an amazing first step, a huge win. But keeping it there, that's the real long-term goal. Managing hypertension isn't a one-and-done kind of a thing. It's an ongoing strategy, and it works best when it's a true partnership between you and your healthcare team. And that partnership follows a pretty predictable timeline. Shortly after you start a new med, you'll get some blood work done to check things like your kidney function, just to make sure your body is handling it well. Then you'll have regular BP checks until your numbers are nice and stable. And every single visit is a chance to talk about how you're doing, if you're sticking with the plan, and any side effects. It's this ongoing conversation that keeps the strategy working for years. This brings us to what might be the most important principle in all of this. Before a doctor ever escalates treatment, before they add another pill to your routine, the very first question they should ask is the current plan being followed consistently? And this is so empowering. It means that you and your consistency, your adherence to the plan, is one of the most powerful tools you have. So there you have it. From understanding what that number even means to diagnosis, lifestyle changes, and the medical plan, you have the roadmap. The journey to manage hypertension isn't about being scared. It's about taking action and working with your team. So now you've got the map. The only question left is, what's your first step going to be?